Coming up today, a young man who was diagnosed with breast cancer. Now he is facing a new chapter. That cancer has returned. It's a story every man should hear. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. When Bret Miller first found a lump as a teenager, his doctors assured him it was nothing to worry about. Until at age 24, he learned the truth. It was breast cancer, and the bottom dropped out. But he fought it and beat it. For 15 years, Bret shared his story to raise awareness that breast cancer does not discriminate. Anyone can get it. Then earlier this year, another bomb drop. His cancer was back. Bret joins us to share his story this morning and where he is at in his journey. That's coming up next. But first, in today's morning rounds, it is all about how you can help support Missy's Boutique at the University of Kansas Cancer Center. We are so proud to say that Missy's was among the first of its kind retail store in the nation. And this patient service center is turning 15 years old. Missy's has been helping cancer patients navigate their diagnosis by providing products and services specific to their disease. It is fitting that a local fashion show helps support Missy's patients. Hall's Spirit and Style Fashion Show is almost here, and some tickets are still available. And you can follow this QR code on your screen anytime during the next few minutes to learn more about it. Let's bring in Kelby Steele. Kelby, it is great to have you here this morning. Good morning.
Hi there. Thanks for having me.
Hello. Well, this is a private event, of course, but how does the public get a ticket? And when is this year's show? Tell us all about it.
Yes. So the show is next Thursday, October 16th. The event doors open at 5. The fashion show starts at 5:30. And anyone can purchase a ticket by making a donation to Missy's. They can make a $100 donation for VIP access to the event and a $30 donation for general admission access.
So 100% of the proceeds from the ticket sales go to Missy's Patients in Need Fund, and then Halls adds in 10% more in sales from the event. How do patrons shop to help make those donations grow?
Yeah, so it's just as easy as that. Come on in, come see the show, and then shop till you drop that night. We have the store just packed with tons of new fall merchandise, so much great outerwear coming in for once it starts to get cold out, new Chiefs gear. We're having trunk shows. Our holiday shop is already set up. So just come on in. We have so many different price points all across the store, and just shop till you drop, and it's shopping for a great cause.
How much money have you been able to raise?
So this is a pretty new initiative for us. Just last year, we created this event just as something new and fun to partner with Missy's and give back to the community. And it raised about $20,000 last year. So just hoping to make this year's bigger and better and spread awareness. And hopefully we can get more people there and just more people involved.
Yeah, every dollar counts. Every dollar counts. And then you had mentioned some really cool items. Is there an online drawing? Is that what I understand?
So anyone who purchases a VIP ticket is automatically registered to win some really legit giveaways. So like a Chloe handbag, a Jimmy Choo handbag, Burberry scarf, Toomey bag, Ferragamo belt, some bottles of fragrances, a $250 Halls gift card. So there's some really awesome giveaways for those who want to make a $100 donation to Missy's. And then also if you make a purchase that evening, you are entered to win some other great giveaways like free pairs of jeans. Varley is giving away a 4-piece outfit in their signature double soft, super soft fabric. Viore is giving away an outfit as well. So just lots of great giveaways, all just, for people who want to donate to this awesome cause. And a lot of our vendors believe in supporting this as well. So they're giving away some great items.
Sounds like it. Hit up that QR code there on your screen for tickets and more information. Kelby, thank you so much.
Thank you. Have a good one.
Thank you. You too. Well, in February of this year, Bret Miller developed a cancer cough. Tests revealed that his breast cancer had returned, and this time as HER2 positive and metastatic. As Bret nears his 40th birthday, he is battling cancer once again. To understand Bret's journey now, we look back at how it all began.
When Bret Miller was just 17 years old, he found a lump in his chest. It was during a routine physical for high school football, and like most men, he didn't think much of it. When he asked his doctor, he was told it was just a calcium buildup. He, nor his doctor, suspected breast cancer.
Being a male, there was just not a lot of information and awareness for men.
But as the years went on, Bret began experiencing strange symptoms. Still, he wasn't concerned.
I did have a discharge from my right nipple that I really didn't tell to anybody. So had I known that was a symptom of breast cancer and stuff, I probably would have acted on it a little bit more.
Finally, when Bret was 24 years old, he decided to take action. He asked his doctor for a breast exam. His doctor then ordered an ultrasound and mammogram at a woman's clinic. The diagnosis came in. Bret had breast cancer.
I was in shock. I thought that I was getting punked. I actually called my dad to let him know. And I said, hey, please don't tell Mom.
But 5 minutes later, Bret's mom, Peggy, was calling, and the next day they were back in the doctor's office looking for answers.
I would expect this knowledge to happen with my daughter, but to have a son with breast cancer at that age, all you can say is, oh my God.
Although Peggy's family had a long history of breast cancer, it was always among women. Bret's diagnosis was a first. He became the youngest man ever diagnosed with breast cancer, and doctors feared after 7 years the cancer had likely spread throughout his body. Peggy shared the news with her great aunt, a nun, who was visiting the Pope at the time. Upon hearing the news, she asked the Pope to pray for Bret. His response was powerful.
Your great nephew was put on this earth for a purpose, and this is his purpose, to get this message out to all mankind that breast cancer does not discriminate.
That big?
Yeah.
Yeah.
That message would become Bret's mission. In 2013, he founded the Bret Miller 1T Foundation to raise awareness for male breast cancer and to help other men who might be facing the same struggles he did.
It's okay to not be okay. There's a lot of mental with it.
And it can be your dad, your brother, your uncle.
Bret has traveled across the country speaking at events and encouraging men to take charge of their health.
Just being more proactive about your health. If you find a lump, don't brush it off. Go to the doctor. If one doctor tells you, hey, it's nothing, don't worry about it, but you don't feel comfortable with it, go to another doctor.
Bret's diagnosis and the journey that followed were not easy, but today he continues to be a voice for those who may feel alone.
It is okay to be diagnosed with breast cancer. Things happen, life happens and stuff. What you do with that is what is going to define you.
And Bret is joining us this morning along with his mom, Peggy. Good morning to both of you.
Good morning. Thank you for having us.
Always good to have you both sitting here together, fighting the good fight together.
Absolutely.
Absolutely. And thanks for my bracelets.
Great.
I want to talk more about this story, and I want to bring in Dr. Kelsey Larson, a breast surgical oncologist, and Dr. Priyanka Sharma, oncologist who specializes in breast cancer, both with the University of Kansas Cancer Center. Thank you both for joining us. We're going to talk more with you in just a moment. Bret, just how are you feeling today?
I'm feeling good. I feel that like all the treatments that I've been getting so far are working. And I can't thank the doctors, Dr. Sharma in particular, since she is my oncologist, for the treatment that I've been receiving.
You shared that this cancer cough tipped you off earlier this year. What happened when you followed up after you started having that cough?
So yeah, I had the cough, pretty much off and on from the beginning of the year, and for me, and being a male, just kind of chalking it up as, oh, it's a cold, it's nothing. I went to the doctor, primary care and everything, and they would give me some medicine, and the cough would go away for a while, and I figured it was good, but it was kind of like every couple weeks or a month or so, and I'd have to come back, and it wasn't until in May when the cough was back, and then I couldn't lift my arm past about here because of pain that was going on here. I was like, okay, something's definitely off. So I called my primary asking to get a referral, thinking that it was just something with my shoulder, but I had to go see the primary first before I could get that referral. So I made the point of when I went into my primary care to not leave without an x-ray. I knew that something was off, chest x-ray, something for the collarbone and everything. And I did leave with the x-ray for the clavicle, and that's when they did the x-ray and they saw the scans and they saw the nodes and everything on the lungs.
That it was
so,
that.
Yep.
Peggy, this was certainly not the news that you wanted to hear. No. That cough, though, you said you knew this was no ordinary cough.
No, he had it before. That's 7 years. And he was at KU, the university where he was going, and he was a phi-sci, and he kept saying, "Mom, it's a phi-sci cough." And I go, "No, it keeps lingering. Something is wrong." And that's when they finally get him diagnosed 7 years later.
You were thinking maybe it was the kids bringing some icky
cough.
Oh,
yeah, just recently. I thought again in February it was back because of the kids. He's got a 3-year-old now and a 6-year-old. So they bring everything home to us, and we get it all.
But what was it like, though, after 7 years, though? You hear this cough and you're thinking, uh-oh. What
Something's
was that like
wrong.
as a mother?
Yeah. I kept pushing, saying there's got to be more to this. It doesn't just stay that long. And all the boys were at the fraternity. They say, "Oh, it's a fraternity house." They catch it. So as a mom, you push it off. Okay, maybe it is, but you just know something's wrong. But we love our wonderful doctors, and finally we all figured it out. Because back then, he, youngest on record being diagnosed. Nobody could believe it. Absolutely nobody. And then he wound up on many TV shows, Katie Couric, The Doctors, Good Morning America with Robin Roberts, and that was before she got diagnosed. So it was just amazing.
Going everywhere, sharing your story.
Anybody that will listen, if I can build the awareness, just make sure that men know it's possible, because we still meet men to this day being like, "Oh, I had absolutely no clue that men could get breast cancer."
And here you are continuing to share. Let's bring in Dr. Sharma. Dr. Sharma, how unusual is it for breast cancer to metastasize 15 years later?
So for hormone-positive breast cancer, which is what Bret had, the highest risk for metastasis is within the first 10 years, but the risk persists for up to 20 years. So unfortunately, we do see metastasis that are beyond 10 years. If you look at statistics, about 15-20% of all metastasis for hormone-positive breast cancer will occur after 10 years, between 10 to 15 years.
Dr. Larson, how many cases do you see of breast cancer in men?
Of all the people who have breast cancer, approximately 1% are male patients. So it's certainly not the majority of patients that we treat, but it's not something that would be considered extremely, extremely rare. And especially here, we have a reasonable number of patients that we see every year and even every month who are people like Bret who noticed something and spoke up and are getting treated now.
So what should men know about breast cancer? I mean, we talk to women about being aware of their breasts and aware of breast cancer, but, we don't really talk about it with men. I could see Peggy over here nodding her head. I mean, we have this opportunity. What should men know about it?
Yeah. I think Bret is not my patient, but I'm happy to hear the wonderful things that he's sharing with people. And I think he's spot on when he says to have some awareness. And if a gentleman or a lady feels a lump or a mass or notices nipple discharge, those would be things to bring to a doctor's attention to try to figure out a little bit about what's going on. And that's the same for men and women.
Dr. Sharma, what is HER2 positive, and how does that diagnosis impact Bret's treatment plan?
So when we say HER2 positive, that means that's the protein or the gene change that is primarily responsible for the cancer growth or feeding the cancer. And having an identifiable protein that is feeding the cancer, that's causing the cancer to divide and grow, is very helpful in coming up with very robust and active treatment options. So for HER2 positive breast cancer, the treatments that are typically recommended in clinic are drugs that target this protein. And as you target this protein and deprive the cancer cells from relying on this protein to grow, the cancer starts shrinking, the cells start dying. We have many, many drugs that target this protein very well in breast cancer, and this is now being used to target in other types of cancers as well. So it's really important for us to know that subtype of breast cancer because that helps us select the most personalized and effective treatment option for that cancer.
Dr. Larson, does the workup or diagnosis process differ for men and women when it comes to breast cancer?
Sure. So women will be doing routine screening mammograms. So many women are diagnosed without a symptom or feeling something because it's seen on mammogram. But men and women, if they notice something, and that usually starts with seeing some sort of a physician or care provider for an exam, and then proceeds to mammogram and ultrasound and a biopsy with radiology if they see something concerning.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Bret, how is this recurrence different from your first diagnosis?
Well, being that it's now stage 4 metastatic, knowing that there is no cure for it, but I know that there are treatments out there that can help, prolong life and give me a longer life to spend time with my kids and my wife. So definitely not the diagnosis that I was hoping for, but I know that there are treatments that are there to help, and I believe I'm on the right path for it.
And are you still continuing to do your outreach as you've been doing it before? And how has that changed?
I think kind of more so than ever. We've got many men in our organization that are stage 4, and they've been around for a decent amount of time now with their diagnosis. So I know that it's possible, and it's just like I said, it's just trying to get the awareness out there for men. By all means, I know that there are hundreds and thousands of more women being diagnosed with breast cancer, and it's a women's dominated disease. All I've ever asked is just that when they talk about women and doing your breast exams, like, here are the symptoms and everything, all we need is just being like, and men too, because that would just that little bit would help another somebody, a female, to go, oh, maybe I should tell my husband. Or my brother, or whatever and stuff, and that little bit would definitely help make sure that men are aware of it and not oblivious to it, and that it although it's very 1%, it's still possible.
Peggy?
Yes, totally agree. It needs to be a topic at the dinner table during the holidays. Bring it up. Make sure, yes, October is Breast Cancer Awareness Month, but it's for people. It's not just for women. And most men don't have a clue that they can get it. And, Dr. Lopa Desroy, who's one of the amazing researchers in University of North Carolina, Chapel Hill, they had the seniors of last year develop the breast self-exam apps. It's Google, it's on Apple. You can download it for free. It pops up. I've been using it. It was launched June of this year. And it pops up and it tells you to do a breast self-exam, but you are also able in the app to be able to put if you found anything, and every 30 days that's popping up. And even me, it's reminding me to do a breast self-exam, and I know to, right? But the bottom line is all of us forget. We get busy lives and we don't remember, but this app that the students developed is amazing, and I suggest strongly for everyone to go online. And it's on our website, malebreastcancerhappens.org, and you can download it for free on your Apple or your Google Android phone. So
great information. You two have been doing this together for so long, and you've supported Bret every step of the way. What for someone who is about ready to go down this road with someone, what advice do you have for other caregivers? What could you tell them?
Be there for them, because they're going to have their ups and their downs. The whole family is. This is not just the patient's disease, it's the family's disease. And you need to be there for each other during the hard times or the great times, because there are a lot of great times. And many, many of our men out there that are stage 4, we've had a lot. We had our conference here in April. We brought in over 20-some specialists on our YouTube channel. You can go view those talks by every doctor that actually talked on the most current treatments and things that are out there on male breast cancer on a global basis. One of our survivors, him and his wife and daughter, came in from Gufu, Japan. He's been spreading the message ever since he got it in Japan, and it is he's been on 2 more shows again, Bret knows, and Germany and Uganda. We work with all these different countries globally to bring the awareness that men have breasts too.
Dr. Larson, you touched on it a little bit earlier, but how do you approach awareness differently for male patients when you have the opportunity?
Sure. I think what they were saying is to highlight just that men need to be aware of this too. And so while, as they nicely shared, it is predominantly women, that doesn't mean that men never get breast cancer. And I think for gentlemen who are feeling a symptom or having a symptom or see something with their doctor, having a role model to look to that is through these groups, through these organizations, through seeing someone do an interview or talks like this, it makes it less stigmatized. So I have a lot of men that come in seeming a bit sheepish or a bit unsure, just because of the diagnosis and because of what it is. So it's really powerful and really helpful to have people like Bret speaking up and sharing their story so that it kind of loses that stigma and it's just part of routine health that everyone needs to be aware of.
Bret, what is your treatment plan moving forward?
I am currently on HER2 chemo treatment. I've completed 5 rounds of it so far. The schedule, I believe, is between 6 and 9. Dr. Sharma can talk on that a little bit more for sure, but I do have scans here coming up on the 14th to kind of see how things are going. I did 5 rounds of radiation with Dr. Stecklein, who I was here with in April. Didn't think that I was going to see him ever again in my life, but I'm glad he was the one that I met. And that proton, that radiation, like it, after the second treatment, the spot on my ribs that they were focusing on was, the pain was pretty much gone from there. So the cough that I had was gone in between the second and third treatments of the Enhertu. So I do believe that the treatment plan is working. And I'm just I'm excited to see where we stand here coming up on the 14th to kind of see the progression of it and stuff. But I'm not giving up. I'm going to keep fighting, and I'll be here for a long time.
Yes, you will. Dr. Sharma, how has the treatment advanced for HER2 positive breast cancer?
So, as I said, having HER2 protein feed the cancer is a very powerful tool to feed the cancer, but it's also a very powerful tool for us to be able to develop very effective therapies. So what Bret described, the drug called Enhertu or trastuzumab deruxtecan, is what we call a smart chemotherapy, where the chemotherapy is attached to the HER2 protein. So the drug, when given to the body, can seek out the cells that express HER2, attach to it, and then deliver the chemotherapy inside the cancer cells. So it's a very, very effective and robust way to deliver treatment to the cancer. For Bret, Enhertu has already started shrinking the cancer, as he described, based on improvement in his symptoms and on the first scans. Besides Enhertu, there are many other drugs that target HER2 that we have available in clinic right now, and many more that are being studied in clinical trials. So over years, we expect to have other drugs that are available in clinic for patients who have a HER2 positive breast cancer.
Bret, you shared a video that shows how to do self-breast exams. While we know a self-breast exam is not a substitute for seeing a doctor, we know that early detection is important. What advice would you give to men who might feel maybe embarrassed about noticing a lump in their chest?
It's just, I mean, it's your body telling you that something's wrong. So it's, do the breast exams, do the monthly ones, and it's the same for females as well. You know, so just so that you're on top of your body, because our doctors see, so many patients a day. They can't keep, it's hard to, keep every symptom to each patient and everything. So we have to be our own best advocate. If you feel a lump, you've got to get to the doctor. And in my case, where it felt like I got pushed off, or being like, oh, it's nothing because of your age and the statistics and the numbers and everything, you have to be the advocate to be like, no, something's wrong. And that's, at the beginning when I was originally diagnosed, for so long I was told that it was calcium buildup, it would go away. Well, 7 years, the lump was still there. This most recent round, I had the cough. I kept on being told that, they listen to your lungs with the stethoscope. And every time they kept on telling me, oh, your lungs sound great. But nobody would do a chest x-ray just because of the additional radiation that, even my oncologist from the beginning told me, like, a lot of doctors don't like doing additional x-rays or anything like that because of the additional radiation. But I went to that doctor that day knowing that I was not leaving without an x-ray. So you just have to be your own best advocate and get the answers that you need to feel comfortable. And for the men out there and stuff, yes, it is embarrassing when you get told that you have breast cancer, but it's what you do after that that helps define what you're going to do and make sure that you live a long life. So don't wait. Don't be our typical men in society and push everything off and not go to the doctor until it's too late and stuff. Just be ahead of it, because if you find a lump early enough, there are treatments out there that you can beat this.
Well said. Let's get to some questions from our viewers this morning. Carla asks, how long are people monitored once declared cancer-free? Dr. Larson?
Sure. So our role as surgeons really is to monitor for local recurrences, which we would consider in the chest or in the lymph nodes. Those typically we check once to twice a year with a clinical exam, and then imaging as indicated. Women would go back to yearly screening imaging. Gentlemen usually would have imaging performed if we felt something on their exam. And I think Dr. Sharma can speak about the systemic monitoring.
Systemic monitoring for people newly diagnosed with breast cancer from the medical oncology perspective is a clinic visit every 3 to 4 months for 2 years after diagnosis, every 6 months after that till year 5. And for those that have hormone negative breast cancer at year 5, typically these patients are released from medical oncology clinic because for hormone positive breast cancer, the risk of recurrence is primarily within the first 5 years. For patients who have hormone positive breast cancer, then since the risk of recurrence still persists, many patients might continue to follow in some form of oncology extended clinics, whether it is with their medical oncologist or with the survivorship clinic once a year thereafter.
Dr. Sharma,
and we always tell patients.
Oh, I'm sorry, go.
I was going to say, we always tell patients to, as we were talking about, is be aware of your body, pay attention to any new signs or symptoms that persist for I typically say something that persists for more than 3 weeks, and that's out of ordinary, even if it is between your scheduled visits with your medical oncology team, to make sure you call them and let them know that you are having this new sign or symptom. So appropriate visits can be arranged, appropriate tests can be ordered.
Dr. Sharma, Jeremy would like to know, does breast cancer in men mean that the women in the family need to increasingly watch out for it too, or is the hereditary nature different when it's in men?
So hereditary nature of breast cancer is similar if it's in men and women. Men who are diagnosed with breast cancer should get genetic testing. If they have a genetic mutation that predisposed them to this cancer or was the root cause of this cancer, then their family members should be tested, first, second, and third blood relatives. And if those individuals have mutations, then their screening and follow-up will be based on the mutation. In absence of a mutation, a man with breast cancer is similar to a woman with breast cancer in terms of family history. So that it usually does not change screening guidelines, because most men that are diagnosed with breast cancer are at an older age. They're older than 40, beyond which the mammogram are routinely recommended for women anyways.
Dr. Larson, I want to get your takeaway today, but I have a question. Can men ask for mammograms? Request them?
Sure. There wouldn't normally be a time where we would routinely screen men with mammograms. There are some very select genes or some very select instances. But remember that screening is trying to give a test where there is a likelihood that we could find something. And so since male breast cancer is uncommon, the utility of a routine screening in general for most men is actually something that wouldn't be beneficial. So self-exam, but actually clinical exam, is what has been shown to detect these appropriately. And so just as Bret had said, most gentlemen, they do have something that's identified by themselves or provider on exam.
What's the takeaway today, Dr. Larson?
I love Bret's takeaway of everyone needs to be aware of the changes that are going on in their health and be empowered to speak up. And particularly today, we're talking about gentlemen with breast cancer and signs and symptoms there. But the overall takeaway, as he said, about the cough and things like that, are the things that can be going on. Everyone has a right to speak up and to say those things. So make sure you're an advocate for yourself. Don't shy away. We want to help people. That's why we all went into medicine. So please let us help you. Tell us what's going on.
Dr. Sharma?
So I would say I'm most excited about the advances that we have made in treatment of metastatic breast cancer. You know, the medicine that Bret's on is one such example, but there are many such other examples where the new drugs are really improving symptoms for our patients, prolonging their lives, such that the metastatic breast cancer is becoming more like chronic disease as opposed to something that leads to fatality very soon.
Doctors, thank you so much for being with us. Peggy, what's the big takeaway today?
Well, if you have breast, you can get breast cancer. And men have breasts too, as our shirts say. So don't forget to be checking yourselves on a monthly basis. All. Make it a date night.
I love it. Thank you for your advocacy. You've been such a great guest for us. We really appreciate you. Bret, thank you for always being so open and willing to share your story. Tell us a little bit about your website and where we can find more information, and talk to us about that. And then just tell us a big takeaway from your story, what you really want people to know.
So you can find everything on our mailbreastcancerhappens.org. There we have all of our resources for your breast self-exams, links for the videos, as well as the link for the app for the Breast Cancer Hub, where you can keep those monthly reminders and any symptoms that pop up. My biggest takeaway would just be that you know your body best. If something's wrong, go to the doctor. You're your own best advocate. But if you keep getting told, oh, it's nothing, but you still feel like it is, well, then maybe you need to find another doctor to get that second opinion. I've had to do it, and like I said, doctors are human too. They see a lot of patients, so I never fault them. Medicine's changing every day, so just be on top of your own body and be your own best advocate.
And you said, go ahead.
We do have it in over 27 different languages. Breast self-exams for men and women. Download the cards, send them to family members.
All right. Thank you so much for all your information. And you said you're sticking around. You're going to come back?
Oh, yeah.
Oh, yeah.
You're coming back, okay?
I'll be back many
You'll be
times.
back?
You
All right.
have me back anytime I can share my story and talk out and stuff. I'm here for you guys.
I love that. Thank you so
Saving
much.
lives.
Saving lives. I love that. We'll do it. We'll do it right here. All right. Thanks to all of our guests today. Thanks to our viewers for being with us. We'll see you back here tomorrow.
Could hearing aids keep your brain young? I'm Alexis Del Cid. On the next All Things Brain Health, we explore the new research suggesting a link between dementia and hearing loss.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.